benefits on neurodegenerative diseases. Myth or reality? See how CBD helps relieve neurodegenerative diseases by repairing, protecting, and cleansing nerve cells, and how CBD can protect nerve cells from the appearance of senile plaques and promotes the renewal of neurons. Founder and medical director, Doctor of Health Research, specialist in regenerative therapies. From France, Dr. Bertrand Canvy.
Hello everybody, I'm Dr. Bertrand Canvy. I'm a French doctor, so sorry for my French accent. I'm not to speak in English every day. So my subject is about CBD benefits on neurodegenerative disease, mitral reality. So let me introduce myself quickly. I'm a founder and medical doctor of Hippocrates Institute. I'm medical doctor, so a team of professionals for the holistic management of degenerative disease and chronic pain. I'm graduated from University of Health and several universities in France, like Lyon, Le Mans, Ivry, and other place. In France, I am one of the first doctors to start to recommend the CBD of my patients in 2012 now. And in my institute, really, I can see a lot of results with my patients with chronic pain and neurodegenerative disease. That's why my topic is about neurodegenerative disease. In France, I make a lot of lobby for better access for CBD. And now I am very happy because I don't know if you know about the news in France, but CBD now is legal. You can use CBD in France now. So I am a director for Canamed too, and maybe one of the most top medical cannabis prescriptor in France. So I'm a specialist of regenerative therapy. I'm graduated from university about stem cell and regenerative medicine. In health, nutrition, and micronutrition, so a lot of things too. I like to write too. I write 50, not 40, 50 books, translate into 11 language, French, of course, English, Spanish, Chinese, Portuguese, Roman, German too, and a lot of language. And I am member of several associations, DAC, IUD, EMA, WMA, World Medical Association, and New Therapy Scientific Committee for European Medical Association Society. So, in my institute, I focus on CBD and about 5 or 6 problems matter about human system, cardiovascular effects, neurodegenerative disease like Alzheimer, Parkinsons, and multiple sclerosis, and treatment of psychiatric disorder like dementia, cancer, and painkiller. Painkiller may be the most unknown, most used in institute, but neurodegenerative disease was my best result. And to explain why, in 2012, when I want to focus on CBD, It's why my mother has Alzheimer's disease. That's why I say, oh, I want to try for her. It's not for my patient, or is my lovely patient, if you prefer. It's for my mother. She has a lot of pain everywhere and starts to lose her mind. What's called in medical a psychiatric disorder. And I was a son, and not only the doctor, and say, what can I try? What can I do for her to help her to improve her health? And I tried CBD. The result was amazing, really amazing. That's why I'm very happy to talk you about this subject, because I am concerned as a doctor, and I'm concerned as a son too. During the last decade, I have a lot of medical research about cannabidiol, about CBD, and all the effect on neurodegenerative disease like Parkinson, Alzheimer, and multiple sclerosis. And when you study, I wrote a book about CBD in French, and it's translated in English. If you want, I can send you, just ask to submit. I can send you my book. There are a lot of studies about pain, human system, cardiovascular effect, and it's easy to read. You don't need to be a doctor to read this book, but there are a lot of studies to demonstrate the result of neurodegenerative disease and a lot of disease. And in nutshell, CBD is a very excellent antioxidant and neuroprotector effective. The subject is benefit of CBD is a myth of reality. Why? Because CBD is, you know that, is one of the main active components of cannabis. Unlike the psychotropic element known as THC in the plant, you know that, is harmless to health and is well tolerated by the body. But what is not known is that CBD is a neuroprotector effect acting on neurological problems and intervening favorably in the treatment of neurodegenerative disease. Among the most common neurological disorders as Parkinson, Alzheimer, and Huntington or multiple sclerosis disease, CBD has improved its effect on the nervous system. Why? Because in this case, CBD is known to prevent nervous cells from rapidly deteriorating and help neuron renewals on its own. What can I say? The nervous cells, you know, during the neurodegenerative disease, like Alzheimer, Parkinson, the cells deteriorating. With CBD, we can rebuild the cells. A lot of studies show that CBD can repair the cellule with the stem cells, improve the number of stem cells in the body. So the first disease is Parkinson's disease. In my institute, I have served this patient with Parkinson. I use CBD for now 5 years, 6 years for Parkinson's disease. I have a lot of results. So I chose a study made in 2040 is the effect of cannabidiol in the treatment of patients with Parkinson's disease. What is the result of this study? They take 119 patients, okay, with a movement disorder with Parkinson. They select 21 patients and assign to 3 groups, 7 people, 7 and 7 people. 7 people with 70 milligrams a day, another with placebo, so nothing, and then another group for 7 people to 300 milligrams a day. What is the result? The result is they found no statistically significant difference in UPDA score, plasma BDNF level, and however, the group treated with placebo and CBD 300 milligram had significantly mean total score in PDQ. Is very, very, very important. I don't know if you understand exactly what I said, not because of my English, but about the medical subject, but it's very important. The effect, the possible effect of CBD improve the quality of life for this population with CBD 300 milligram. That's why now they made a study with a larger sample. They do it in this year, in start of the years in January. You don't have the result now, but the first result, because I work with this team, said the result is the same as this one, is 2014. So it's very, very important for the future that show that CBD can really improve the life for Parkinson patient. Another study about Parkinson. They diagnose many women and men. You know that Parkinson is most of the time man, and for Alzheimer is a woman. And in the case of Parkinson's disease, you know that they affect the central nervous system. And most of the time, it gets worse in 7 and 14 years after the first diagnosis. Regardless of the cause of the disease, whether genetic or environmental, Parkinson's disease is claimed to be a decrease in the secretion of dopamine. You know that the link between the secretion of dopamine and the getting worse for the disease. People who use CBD with Parkinson's disease has a better movement, can better control movement, and can reduce the dementia too. But a new study is work now with very large amounts, 2,000 people with Parkinson's disease. At this time, they show that muscle stiffness and controlled movement is better with CBD. About Alzheimer. Alzheimer, you understand, because of my life, my mother, and my patient is maybe the most important for me. Um, and the results I said was very amazing on my patient and my mother too. So there are a study very important in 2018. So Alzheimer is a disease occur when the protein beta amyloid build up and alters neurotransmitter and causes inflammation in certain area of the brain. CBD in the study show that they can reduce the appearance of the senile plaque. You know the senile plaque? And can eliminate inflammation or Alzheimer cause inflammation, and CBD can eliminate inflammation in nervous cells. And from immune cells of the brain called micrological cells, the inflammatory response specific to Alzheimer's disease are in fact eliminated by CBD. In addition to the neuroprotective properties to reduce the degeneration of nervous cells, CBD acts on the brain receptor responsible for sensations such as pain, euphoria, anxiety, and stress. Patients then regain a zest for life that is often absent in Alzheimer victims. So, what is main important in this study? They show that when you use CBD, the dose of THC can enhance the mitochondria function. It does not inhibit melatonin's enhancement of mitochondria. And I don't know if you worked about with what Alzheimer disease, but melatonin is very important for. It's very important for Alzheimer disease. You can you must have a scale of melatonin and to check your melatonin everywhere. About multiple sclerosis, two studies, but just one for you is the most important, is cannabis in the treatment of multiple sclerosis positive limits in 2015. What show this study? The conclusion is cannabis sativa plant extract might lower spine frequency and increase mobility with tolerable side effects in patients with persistent spasticity not responding to other drugs. So with cannabis, you can improve the spasm, decrease the spasm for multiple sclerosis. So for multiple sclerosis, for Alzheimer, for Parkinsons, CBD with THC show an important improvement for the malady. In conclusion, whether Parkinson, Alzheimer, or multiple sclerosis or Huntington, CBD helps relieve neurodegenerative disease by repairing, protecting, cleansing nerve cells. It protects nerve cells from the appearance of senile plaque and promotes the renewal of neurons. Whether cell degeneration is related to age, trauma, genetics, or another reason, CBD is further a natural therapeutic resource of choice, accessible to all. Alors, tac. 1 minute live. It's okay. Thank you very much. I hope you can understand what I said exactly. But CBD is so useful in institute. Really, I'm very happy to use CBD every day. I said, wow, it's magical. No need to have studies from famous doctor. Just said in the experience when you can see your patient have a better life. It's amazing. So thank you very much. And if you want my books,
yes, thank you so much. We look forward to hearing more about this CBD on Alzheimer's and neurodegenerative diseases in our discussion panel this evening. I personally have experience firsthand with my grandmother and Alzheimer's, so I've already shared one of your slides with my mother, who's also concerned about it, and this is very encouraging information. Thank you so much.